welcome again. Today we're going to look at another hormone, and this hormone is thyroid hormone, and we're going to see how it's regulated in its release and also its basic role within the body. Again, thyroid hormone is associated with the hypothalamus, the pituitary, or the anterior pituitary to be more specific, and of course the thyroid gland itself, or the thyroid. Now again, the whole setup starts with the hypothalamus, and in the hypothalamus you have cells that secrete a hormone called thyrotropin releasing hormone. This TRH is released from the hypothalamus into the portal blood vessel system, which will send the TRH directly to the anterior pituitary. At the anterior pituitary, the TRH will act on thyrotropic cells, and these thyrotropic cells will then secrete the hormone thyroid stimulating hormone, or TSH. TSH will then go to the thyroid gland. Well, it will have a number of effects. One of them is to increase the synthesis of thyroid hormone, increase the release of thyroid hormone, and it also increases the size of the overall thyroid gland. So when TSH binds to its receptors on the thyroid gland, it will stimulate the release of thyroid hormone. What is thyroid hormone? Well, thyroid hormone comes in two forms. There's T3, which is triiodothyronine, or T4, which is thyroxine. Now, the activities of these is different. T3 here is about 10 times more active than T4. It has 10 times a greater biological effect, but when we see normally release from the thyroid hormone, about 90% of thyroid hormone is released as the T4. This T4 will travel around the body, but usually what will happen is once it enters the cells where it has its action, it will then be converted into T3 and thus still have the greater biological effect. But we're getting way ahead of ourselves here. What does thyroid hormone do? Well, thyroid hormone has a number of different roles in the body, and overall we can say what thyroid hormone does is it maintains our basal metabolic rate. The more thyroid hormone we have, the greater our basal metabolic rate is. So it's going to increase metabolism, it increases heart rate, it increases activity of enzymes and so on. So it just basically increases our whole activity. It's a very important hormone, but you see more of it when, it's more important when you see the effects of low levels or high levels of that, but that will be something we talk about later. So, thyroid hormone gets released, it has its effect on basal metabolic rate, but how is the release of thyroid hormone controlled? Well, again, it's the classic negative feedback system. So, the thyroid gland releases thyroid hormone, and what the thyroid hormone then does, I'll do this in blue this time, is it negatively feeds back on the hypothalamus, and it negatively feeds back on the anterior pituitary. The hypothalamus has thyroid hormone receptors on the cells that secrete thyrotropin-releasing hormone, and so thyroid hormone levels will negatively feedback, thus decreasing TRH levels. At the same time, the thyroid hormone will also negatively feedback on the thyrotropic cells. They too have thyroid hormone receptors, decreasing the release of TH and TSH, and so maintaining thyroid hormone levels. Also, but probably a little less important, is TSH itself can also negatively feedback directly on the hypothalamus to decrease TRH levels. So, in a nutshell, The thyroid, or the release of thyroid hormone, is under the control of the hypothalamic pituitary thyroidal axis. TRH causes the release of TSH, which in turn causes the release of thyroid hormone, and this thyroid hormone will increase our basal metabolic rate, but it will also negatively feed back on its releasing hormones to control, to make sure that its release is at the right levels.